Hello, I am Dr. Vinay Kumaraswamy, Orthopaedic Surgeon, Consultant Orthopaedic Surgeon, Arthroscopy, Sports Injury and Shoulder Specialist, Fortis Hospital, Rajajinagar. Today we'll discuss some of the common shoulder problems that ail patients, especially above 40 years of age. This is our shoulder. It has got multiple structures. It has got a covering around it and it has got 4 important muscles around that. In day-to-day life, our shoulder goes through a lot. From carrying heavy vanity bags to laptop bags to carrying dumbbells in the gym to complex yoga posture, we make our shoulder go through a lot in day-to-day life and it aches once in a while. The common shoulder problems are frozen shoulder, where the capsule around the shoulder or the covering around the shoulder becomes really tight. Then there is something called as rotator cuff tear. The important muscles around the shoulder, they get torn, and the muscles around the shoulder can also get inflamed. We'll talk about the most common problem that ails people above 40 years in shoulder, which is frozen shoulder. Frozen shoulder basically means when your shoulder becomes stiff. What happens is the covering around the shoulder becomes really tight. The patients are not able to sleep in the night because of the pain. They are not able to do their routine day-to-day activities. They are not able to comb their hairs. They are not able to scrub themselves when they are taking bath, which affects them a lot. Frozen shoulder commonly happens to people above 40 years who are diabetic and hypothyroid. Usually lasts for 1 year to 2 years. So the patients have to put up with this pain for nearly 1 to 2 years. Why go through that? The common understanding of patients is that physiotherapy is the only treatment for frozen shoulder, which is wrong. We have multiple treatments for frozen shoulder these days, which will cut short your duration of pain by a big duration. Why suffer for 1 year? We have treatment, something called as hydrodilatation, where we inject fluid into the shoulder in high pressure and enlarge the capsule. That helps in relieving the pain. If that does not help you, then we have keyhole surgery in releasing the tightened structures around the shoulder. What we do is we put a small video camera into the joint, see all the structures which are tight, slowly release it. That will result in pain relief. So frozen shoulder is something which is not to be put up with these days. There are multiple treatments available for frozen shoulder these days, including hydrodilatation and arthroscopic or keyhole surgery. Don't suffer. Contact us. We'll help you out with your shoulder problem, primarily frozen shoulder and rotator cuff tear. Thank you.